Hi, I'm Beth Overmoyer. I'm the director of the Inflammatory Breast Cancer Program here at the Dana-Farber, and I've been asked to talk to you a little bit about the reason why you're here today. Just to give you some background, inflammatory breast cancer is very rare. It occurs about 2 to 5% of all of the diagnoses of breast cancer in the United States, and it is one of those diseases that is not found early. It comes on very quickly, and it really is one of the most aggressive forms of breast cancer. The symptoms of inflammatory breast cancer mimic mastitis. So the breast suddenly becomes enlarged, it's red, it's inflamed, it's tender, there's often no mass, and it is not able to be surgically removed at the time of diagnosis. The other sad part about inflammatory breast cancer is that a third of the time it has already spread to other organs, such as the lung, the liver, the bones, at the time of diagnosis. So Nancy Duffy, a wonderful, lovely woman who I was very privileged to be with and take care of for many years. Not long enough. Nancy presented with inflammatory breast cancer, and unfortunately, the cancer had spread at the time of diagnosis. But she was a fighter, and she knew that this rare and aggressive form of breast cancer needed to be stopped. And she wanted to focus on research, and that's why you are all here. Because of the rarity of inflammatory breast cancer, funding for research for this disease is scant. It's difficult to get grant money. So we rely on the generosity of people like you and other people who are interested in wiping out this disease. Where does the money go? It goes to many things. There are 3 clinical trials at the Dana-Farber focusing on the treatment specifically for inflammatory breast cancer. Unfortunately, Nancy was not eligible for one of those trials that targeted her specific type of inflammatory breast cancer, the HER2-positive subtype. We also used the money to fund our basic scientists who obtain tissue from our patients' generosity. They donate biopsy specimens so that our basic scientists can study inflammatory breast cancer and find out why it starts, why it's resistant to treatment, and how to wipe it out. Because of funding from people like you, we've been able to determine new therapies for inflammatory breast cancer, and we've been able to bring those therapies into clinical trials today. So your money is actively doing good right now. So I really want to thank you, and all of the patients who have inflammatory breast cancer want to thank you too, because it helps everyone throughout the world when you give and we use your money to advance the understanding and the treatment of this devastating disease. And I know Nancy's here with us today. I know she's sitting next to Kenny and the rest of the family. And I just wanted to take her words and thank you for being here.